Well, greetings, Dr. Narain. How are you?
I'm all right, thank you. How are you?
I'm well. Thank you so much for talking to me today.
It's a pleasure.
Give me a little sense of how your week has been in London.
So I'm a cardiologist at St. George's University Hospital, which is one of the biggest teaching hospitals in England. And we have got a huge cardiology department which looks after almost 1/3 of south of London. We are attached to lots of different district general hospitals, so we look after a lot of patients which come to different hospitals in that part of the city. We have been quite badly hit because London, as you know, is one of the worst hit cities in the country. And fortunately or unfortunately, our part of the city is quite badly hit, and my hospital is getting a lot of these cases.
What do those numbers look like?
Yeah, I mean, at the moment, we have got about 5, 6, 7 wards which are full of COVID patients, and their numbers vary between 300 to 400. We have got a big intensive care unit which has got more than 30, 40 patients who are on ventilator. So I would say at the moment, looking at the hospital, we've got about somewhere between 300 to 400 patients of COVID.
What are the things that any of us should know are the ways that we can best prevent COVID coming into our personal worlds or the worlds of those that we love?
One important thing that we all know and we have realized that if we do social distancing properly, if we test the people who are suspected to have COVID and segregate them and separate them from the society and keep them away from rest of their family and friends and keep them safe, then that is the best strategy. And as far as society is concerned, I know it is very challenging and there are lots of issues because we have never been in a world like this in our lives. And this is for the first time that we are facing something like this, a huge crisis, a health crisis, a global crisis. And we have now realized that social distancing is the only thing that is going to prevent this from becoming an even bigger pandemic, unless there is a vaccine that is in development that comes in and we get mass vaccination across the globe and prevent any more cases. But I think at the moment we have to prevent each other from getting the infection by social distancing.
In addition to social distancing, what about sheltering in place? What are the policies that you're advising people to adhere to with regard to staying home when they can, working from home as they can? How are you approaching that component?
Yeah, it's been, because as I said, that this is something that we have never done before, and it is such a challenging topic because important key workers who have to go to work, like doctors, nurses, healthcare professionals, police, fire brigade, people working for supermarkets. So these people who are key workers, people who are working in the nursing homes, they have to go to work because they have got something to look after the society. And for them, unfortunately, things have not changed because they have to go to work. We are going to stop our lockdown, I think it's on the 3rd of May. So after 3rd of May, there's this discussion that if we start this school, because again, a lot of people are struggling to go back to work because children are at home, so they don't have enough care at home to look after the kids. So kids have to start going back to school. If that has to happen, then there is a discussion that possibly some children will have to go in the morning, some will go in the afternoon, some in the evening. Many of the children, as we know, are having Zoom and Skype and different kinds of platform audiovisual teaching at the moment. But I would say that it's very challenging because we have never done this in our life and we have never experienced anything in our life like this. And I don't think any country in the world was fully prepared for something like this. No matter how big your economy is, no matter how small your economy is, no matter how good you're in healthcare, none of us were prepared for this because no one expected that something like this to this extent will happen.
So the difference becomes what is essential defined by what is bettering the community versus what
Correct.
is bettering the individual.
Yes.
Can you comment on that idea?
Yes. So again, I think it is important because, I mean, at the moment, this is a war that is, we all of us, especially in the healthcare professionals, are fighting with an invisible enemy. So we don't need police or army or a fire brigade to fight this army. We need healthcare professionals mainly to fight, but obviously everybody has to support in the community. So all of us have to play our roles in a limited way, in a sophisticated way, in a planned way, so that again we do not spread the virus, but again every support system is supported by by the healthcare professional. For example, the police have to do their work. The fire brigade have to be at their work. People in the grocery shop, in the supermarkets, every staff have to go and look after the community, because unless they are working, we can't get our food. So everybody has to play a small role here and there. We all have to fight it together. The whole of the community has to come together to fight this, because this is one of the biggest challenges that we are facing at the moment in our lives.
One of your very active missions outside of the hospital is Global Health Alliance. How is
Yes.
Global Health Alliance working to continue tackling efforts towards basic life-saving education and advanced cardiac life-saving skills with India, who is really just now coming into the wave of the coronavirus?
Yeah. So most of the work that we have been doing through Global Health Alliance was in India and some in the UK. In India, what we are now doing is that we are trying to train about 200 doctors on how to manage patients on ventilator. Because in India, there's a likelihood that by mid-May, it will hit a peak and there will be thousands of cases across India. India, as you know, is a huge country, 10 times bigger than England, possibly bigger, even bigger than that. And there are, again, lack of resources, lack of doctors, lack of ventilators. So India is preparing well. India so far has done very well, as we know, that they started social distancing quite in advance, and they preempted the problem which was coming through. And they have, in some way, managed to stop the virus so far. But there are so many different challenges in India that there is a possibility that this virus still may affect a big number of people, a big number of the population in India. So the government is making lots of decisions, planning to see how they can fight the infection.
We keep hearing about second and third waves. Can you explain to me what we need to understand about the implications of that?
Since most of us have been housebound for the last few weeks or couple of months almost in some part of the world, there is a possibility, and a lot of scientists have said that if we don't act smart and we don't defeat the virus in a planned way, and we just stop the lockdown suddenly and come out of our houses suddenly, there is a possibility that the virus may come back again. So that is why what is required, I think, and we all realize that the next coming weeks and months are going to be extremely challenging, because we have to plan our lockdown and coming out of lockdown and going back into intermittent lockdown possibly again in a smarter way, so that we can defeat the virus. Because there is a possibility that the virus may come back again if we completely remove the lockdown and we all are out like what we were doing before the pre-corona scenario. So I think it is important that whatever we do, whether it be America, India, or any part of the world, it has to be in a staged process, in a staged manner, so that things are under control.
So in England, it is a countrywide lockdown until May 3rd. Is that correct?
Correct.
Okay. Now, are you comfortable imagining whether or not that lockdown would be extended?
I personally feel that we are still in the peak of the virus, because at the moment we are having about an average death between 700 to 900 per day. So we have now hit the peak. We are possibly in the plateau phase, after which number of new cases have already started coming down slowly, but we should not get excited about it. We have to be careful about it. And I think what is required is that possibly post May 3rd, even if we have some relief on the lockdown and we say that some of the services can be opened up, then it will have to be on a city by city basis. We'll have to identify hotspots. Which are the cities most affected? Which are the cities least affected? So if you can identify those hotspots where the cases are massive, then obviously like place like London, I don't think I can imagine that things can start going back to normal after May 3rd. We need another possibly few more weeks before we start easing off on the lockdown. But possibly in the Northwest, where the cases are slightly less, there's a possibility we could look at having more relaxation in the lockdown. But I think it will have to be city-based and in a more planned fashion.
What is the set of choices the most responsible citizens can make moving forward as we look out towards May and June?
Yeah, I think it is still very important, because we don't realize, although the general perception is that corona normally hits people who are elderly, who are diabetic, who have got heart disease, who have low immunity. Those are the people who are likely to get affected. But we also need to realize that in UK and across the world, we have seen lots of young cases, young patients going on the ventilator and not coming back. So you don't want to be, although we know and realize that 60, 70, 80% of the people who get coronavirus, they recover very well if your immunity is good. But you don't want to be in that 10, 15, 20% who don't make it and end up on the ventilator and possibly 50% chance of not coming back from the ventilator. So, and no one knows who gets that bad lottery. That is the problem. So it is important, I think, that people who can work from home, can manage from home, should try and do that. People, even if who are going out, they have to take precaution. They have to maintain hygiene. They have to have cleanliness around, have to keep washing their hands on a regular basis, which is very, very important. Wearing a mask is controversial. WHO says people who are not affected should not be wearing the mask. And especially we are living in a world where there is lack of PPE. So again, we have been told in the UK that general public should not be wearing masks because there's not enough mask for healthcare professionals, forget about general public. So it is important, I think, we follow what the WHO says, we follow what our respective governments are advising, because they are all advising based on the best scientific evidence the scientific advisors and the medical advisors are giving to the government. So I think people who can work from home should try and do that for the next few weeks at least. People who are going out have to take extra precaution and obviously keep washing their hands and stay away from each other as much as possible. I think that is most important in the coming weeks and months.
How are you personally finding inspiration and impetus to keep going? It's dark right now.
The very gratitude that the society show us in the way that every Thursday they come out and clap for a few minutes for us. The fact that the supermarkets have got designated slots for doctors because they know that doctors, nurses, healthcare professionals are the people who are fighting this war. And as far as inspiration is concerned, it is so nice. The feeling when you are able to save somebody's life by timely intervention, timely treatment, it gives you so much of inspiration and courage that this is something that is making a huge difference across the society, because you're able to save somebody's life, which is most important at the moment. The whole world has come to a stop because of one virus. And it is the healthcare professionals who are fighting this war. And we have to kind of save the mankind from an imminent threat which is out there. So I think, and the society is very supportive. The whole society has been supporting us in every way possible. So I think that is the main inspiration, that you are in a position that you are able to do something for the society, save life. So that is very, very important, I think. We have to stay positive and we have to win this war. There's no plan B here. I mean, we have to win this.
What do we also need to learn from this? How can we not be here again?
Very good question. And it is very important that as an individual, we understand, and as a government, the governments understand. So as an individual, what we need to understand and what we have learned is that you have to respect nature, because nature is something that you feel like nature has taken over. For example, when I go to India, the AQI index, the air quality index in Delhi is about 400 to 500. The AQI index normally, the AQI index now in Delhi is 15 to 20, half than London. So it is one of the cleanest city pollution-wise in world today. It is normally one of the most polluted city, but today it is one of the top 5-10 cleanest city in the world. So how did that happen? You know, nature, as if a force from nature has taken over to tell us and make us realize the importance that we need to protect our nature. That is very, very important. So no matter what we do, whether it is recycling, whether it's using less of our cars, whatever it may be, we all have to do more of that. Possibly there is a need for all of us to have a week or two of social distancing every year, because that might be the way forward in the future. Who knows? That maybe is something that we all have to think about, because we are seeing lots of stories in the news that there are kangaroos coming out in streets of Sydney, more of dolphins in Venice, more of birds in my garden. So how is this all change? This is completely back to reality, back to nature. So this is very important as an individual, I think, for all of us to realize that we need to do everything which is important to protect the nature, everything which is important to make us live healthy life forever. When it comes to government, I think all the governments in the world are now stuck. Their economy has gone down by 30, 40, 50%. So they are now realizing that health is very, very important, especially in countries like India, where they only spend 2% of the GDP on health. So we all have to be prepared that if something like this happens, what are the key steps that we can take straight away to stop from people dying like we are, like UK, possibly there has been a slightly delayed response as far as social distancing is concerned. So maybe we have all learned lessons that possibly all these important steps which we should have taken at an earlier time should be taken more sooner if it comes back. But health is something that is very, very important now. We all have to take care of our health. The government has to look after our health because they have to invest more in the healthcare, which is very important.
The amazing American poet Hannah Drake said to me the other day, when I asked her what surprises her most about this, she said that it's astounding to recognize, and I think maybe we could all say this for the first time ever, if it happens to an individual in Wuhan, China,
yes,
it happened to me. We are
correct.
so connected.
Connected, absolutely. And we are also realized that spending more time with family, with doing some small things with your kids, with your family, brings that happiness. Happiness is not always in going to big holidays and going to big restaurants. Obviously, that is also exciting and brings happiness. But again, doing small things within your family, spending some more time with your kids, which you normally are not able to do in your normal busy day-to-day life. So we have again realized something else, that there is some hidden happiness that you were not realizing because of the fact that you were so busy in your day-to-day life.
I feel so emotional hearing you say these things. It's a cruel,
but it's a fact, Teresa, it's a fact.
Exactly.
We're all realizing how things have changed in our day-to-day lives. Have completely changed.
Yeah, we are slow to learn, we humans. It's a shame that it takes catastrophe for these profound lessons.
Yes. But again, this has come with a price, that we have lost so many lives of innocent people through this virus. But at the same time, there are lots of reports suggesting that the number of heart attacks, number of strokes, number of lung-related, pollution-related deaths have gone down globally. So again, there's a message here that we have to keep our environment clean, love the nature, look after the nature, and the nature will look after you.
Thank you so much for your time and your candidness and your heart, and for what you're doing. I appreciate it.
Thank you very much.
And I thank you.
Thanks for your time, Teresa.
Take good care of yourself.